Medicare Part B. You know you need it, but do you actually know what it covers? A lot of people think it's just for doctor visits, but it's way more than that. I'm Adrienne, a licensed Medicare agent, and today I'm breaking down exactly what Medicare Part B covers, what it costs, and what you need to know before you enroll. Whether you're turning 65 soon or you're already on Medicare, this video will clear up the confusion around Part B. Let's begin. So first, let's clarify what Medicare Part B actually is. Part B is your medical insurance. It covers things like doctor visits, outpatient care, preventative services, and medical equipment. It's different from Part A, which covers hospital stays. Think of it this way. Part A is for when you're admitted to the hospital. Part B is for everything else, like your doctor appointments, lab tests, x-rays, and preventative screenings. Part B does require a monthly premium, which most people pay directly out of their Social Security check. For 2025, the standard Part B premium is $185 per month, but it can be higher if you earn above certain income limits. That's called IRMA, which I'll cover in a future video. Let's get into what Part B actually covers. First, medical services. Part B covers doctor visits, both your primary care and specialist. It covers outpatient care, which means services you get without being admitted to the hospital. That includes things like emergency room visits, outpatient surgery, and clinic visits. It also covers lab tests, x-rays, and other diagnostic services your doctor orders. If you need an ambulance, Part B covers that too, as long as it's medically necessary. And here's something a lot of people don't know. Part B covers mental health services, including therapy and counseling. So if you're seeing a therapist or a psychiatrist, Part B helps pay for those visits. Part B also covers a ton of preventative services, and many of these are completely free, meaning you pay nothing out of pocket. You get one free annual wellness visit every year where your doctor reviews your health, updates your medical history, and creates a personalized prevention plan. Part B covers cancer screenings like mammograms, pap tests, and colonoscopies. It covers cardiovascular screenings to check your heart health and cholesterol levels. If you have diabetes or are at risk, Part B covers diabetic screenings and even diabetic supplies like test strips and monitors. And vaccines. Part B covers your annual flu shot, pneumonia vaccine, hepatitis B, and others. Taking advantage of these preventative services is one of the smartest things you can do on Medicare because they help catch problems early when they're easier and cheaper to treat. Part B also covers durable medical equipment, or DME. This includes things like wheelchairs, walkers, canes, and crutches. If you need a hospital bed at home, Part B covers that. It covers oxygen equipment if you have a respiratory condition, blood sugar monitors for diabetics. The key is that the equipment has to be medically necessary and prescribed by your doctor. Part B typically covers 80% of the cost after you meet your deductible, and you're responsible for the remaining 20%. That's where a Medicare supplement plan can help fill in the gap, but we'll talk about that in another video. Now let's talk about what Part B doesn't cover, because this surprises a lot of people. Part B does not cover routine dental care. It does not cover routine vision exams or eyeglasses. And Part B doesn't cover hearing aids. It doesn't cover long-term care or custodial care. That's daily help with things like bathing and dressing. Part B also doesn't cover most prescription drugs that you pick up at the pharmacy. That's what Part D is for. It doesn't cover cosmetic procedures, and it generally doesn't cover acupuncture, though there are some exceptions for chronic lower back pain. These are the gaps that catch people off guard, and it's why having additional coverage, like a Medicare Advantage plan or a Part D drug plan, is so important. Here's my perspective on this. A lot of people enroll in Medicare Part B without really understanding what it covers. And then they're surprised when they get a bill for something they thought was included. Or worse, they skip preventative services because they think they'll have to pay for it. When in reality, those services are free. Understanding what Part B covers and what it doesn't gives you control. It helps you use your benefits the right way, catch health problems early, and avoid unnecessary out-of-pocket costs. And if you know where the gaps are, you can plan for them with Part D or a supplement plan. Knowledge is power when it comes to Medicare. And the more you understand Part B, the better decisions you can make about your health care. Let's talk about what Part B costs. For 2025, the standard monthly premium is $185. Most people have this automatically deducted from their Social Security check. There's also an annual deductible of $257, which means you pay the first $257 of Part B services every year. After that, Part B typically covers 80% of approved costs, and you're responsible for the remaining 20%. That's called coinsurance. Now, if you're a higher earner, you may pay more than $185 a month due to something called IRMA, which stands for Income-Related Monthly Adjustment Amount. IRMA kicks in if your income is above a certain threshold. That's something I'll be covering in detail in a future video. So here's what to remember. Medicare Part B covers doctor visits, outpatient care, preventative services, and durable medical equipment. Many preventative services are completely free, so take advantage of them. Part B doesn't cover dental, routine vision exams, glasses, hearing aids, or most prescription drugs. You'll need a separate coverage for those. The standard premium for 2025 is $185 a month, plus a $257 deductible and 20% coinsurance. Understanding Part B helps you use your benefits wisely and avoid surprise bills. If you want a complete Medicare starter kit with everything you need to know about Parts A, B, C, and D, plus a Turning 65 checklist, download it free at guides.avwinsurance.com/turning65. If this was helpful, subscribe for more Medicare tips every Tuesday and Friday. Thanks for watching. I'll see you in the next one.